So my video is on the treatment of aphasic perseverations, also known as TAP, and it is a treatment approach for people with aphasia who have perseverations, and they can perseverate on speech sounds, words, utterances. As long as they perseverate, they're a potential candidate for this approach. However, the optimal candidate is going to be somebody with moderately intact comprehension, good memory, and moderate to severe perseverations. And so before you actually begin the treatment approach, you're going to give the confrontation naming portion of the Boston examination. And once you've given the confrontation naming portion, you're going to determine the severity of their perseverations, and they can score within minimal, mild, moderate to severe. And then from the confrontation naming portion, they do categories in that portion of the test. And so you're going to develop a hierarchy of treatment steps for your client. So you're going to begin with the most successful category that they had, and then you're going to work your way up to the most difficult or challenging category when working with this client over multiple sessions. And so the first step of implementing the TAP approach is to educate the client on what perseverations is, and then you're going to instruct them to pay particular attention to their perseverations so that they can potentially avoid them or reduce them. So I'll demonstrate. Okay, Cheyenne, so today for therapy, we are going to target your perseverations. And so perseverations are when you say a word in conversation or in an activity, and then later on you say that word again and again, and it's not necessarily appropriate for the conversation, or it's not the word that you're wanting to say, or I'm wanting to hear. So it's basically when you repeat a word.
Okay.
And so in therapy today, I want you to try and pay particular attention to your perseverations, because when we increase your awareness of when you perseverate, it can reduce or even suppress those.
Okay.
Okay, so that's the first step. You want to educate the client on what perseverations are and kind of give them awareness of their perseverations and to pay particular attention to them. So the next step is the confrontation naming activity, and that's kind of the bulk of this approach. What you do is you're going to use the hierarchy that you've already established based on the Boston, and then you're going to start with the most successful, and over sessions go to the most challenging category. And then one part of the TAPS approach is that between pictures, you want to take a 5-second interval before presenting the next picture. And then as you're doing the therapy, you want to draw attention to their perseverations. One way to do this is if they continue to perseverate on a certain word, you're going to write it on a piece of paper, and then you're going to rip it up in front of the client. And it's kind of like a visual reminder that that word, we're no longer saying that word. And so, okay, Cheyenne, what is this?
Arm.
That's right, that is an arm. Okay, what is this?
Arm.
Okay, look at here. What is this?
Arm.
Okay, ready?
Leg.
Yeah, that's right, it is a leg. Great job. Okay, what is this?
Arm.
All right, so I'm gonna write arm real big on this sheet of paper. Then I'm gonna rip it up. Okay, Cheyenne, so arm, we're no longer using arm anymore. That word's gone, don't even worry about it. Okay, so what is this?
Knee.
Yes, that's right, that is a knee. And so that's kind of how you implement the visual cue and how you progress between pictures. So as you have a client name a picture, you're going to monitor the number of items that they name correctly, and you can count a picture correct if you've given only up to 3 cues. If you've given over 3 cues, then that picture's, you mark it as incorrect. And then you also want to tally up the number and the types of words that the client perseverates on, just to have data as you progress over the therapy sessions. And so for the demonstration I just did with Cheyenne, I did several types of cues, and there are actually 11 types of cues that you can do through this approach. You can do gestures, graphic descriptions, spoken descriptions, drawings, writing, and you can also do like speaking or singing in unison. It just kind of depends on the client and what cues work best for them. And then lastly, if the client's doing really well in a session and you want to switch between categories, all you have to do is inform the client, because if you don't, they can have stuck-in perseverations where they use the previous words in a category. So, okay, Cheyenne, how do you feel so far about what we've done in therapy?
I feel good.
Well, that's good. I think you've done well. You named all the pictures, and when we had perseverations, we worked our way through them. So now we're done with body parts, and now we're going to go to action pictures. And that's just how you switch between categories. And that's basically the TAPS approach.